Changers? It's Coach Jenn here with Academic Coaching for World Changers. So today we're going to talk about a topic that is commonly assessed on the Big Three or the Big Four, depending on if you're taking the CPCE. But this topic is commonly assessed on the NCE, the NCMHCE, I think I got it that time, and the LCSW. The CPCE does assess this topic as well, but we're kind of focusing on these three exams. So that being said, what can be confusing or convoluted for some people is the difference between borderline personality disorder versus a standard, just a typical personality disorder. So we're going to talk about understanding the difference between those two concepts that are often conflated. All right, so understanding the difference between the NCE, the NCMHCE, and the LCSW for success. Let's go. So why this matters for your exam? Personality disorders. Personality disorders are this blanket, right? And under the blanket of personality disorders, things like antisocial, borderline personality disorder, and schizotypal personality disorders are just personality disorders under this blanket of personality disorders. So they are commonly tested across each of the three exams. So we want to understand the difference between borderline personality versus just a personality disorder because people often confuse the two. So we want to do so in order to identify accurate diagnosis, recognize DSM-5 criteria, and apply proper interventions. If we are able to master the differences for each of the exams, we will be able to master clinical reasoning. Clinical reasoning not only for your exam, but when you are in practice, you'll be able to recognize that borderline personality disorder falls under the category of personality disorders. Now, what are personality disorders? Personality disorders, any of the personality disorders, whether you are referring to cluster A, cluster B, or cluster C, all have enduring, inflexible patterns of behavior and emotion. This is kind of where I think people get a little tripped up with borderline personality disorder and personality disorder because all personality disorders have enduring, inflexible patterns of behavior and emotion. They cause distress or impairment. So much so that people really sometimes have difficulty functioning. And that's kind of what the LCSW focuses on. Most of our personality disorders start in adolescent or early adulthood. So that being said, if you ask someone's like relative who is has 5 of the 9 criteria, they will likely tell you that person has been that way for the majority of their life, especially if they have known them. They've always been in an emotional wreck, or they've always been in fight or flight mode. That's what they will describe for you. And that's how you can kind of dictate whether or not someone has a personality disorder based on whether or not they had it in adolescent or early adulthood. So again, I mentioned clusters. This isn't an all-inclusive DSM video. This is just to go over personality disorders versus borderline personality disorders. So I'm going to go over some of this stuff briefly. However, if you want a full video on a lot of the disorders you will see on your exam, whether it's the LCSW, the 5-letter exam, or the NCE, reach out. We are happy to make videos upon request. Now, clusters. We have cluster A, which are odd or eccentric. We have our paranoid personality disorder, our schizoid personality disorder, and our schizoid typal. That is another good video, by the way. Schizoid versus schizoid typal. We have cluster B, dramatic or emotional or emotional. That's where borderline personality disorder falls under. So remember, personality disorder is the umbrella. Borderline falls under category or cluster B. Narcissistic personality disorder, antisocial personality disorder, and histrionic. And then C, anxious and or fearful. avoidant, dependent, or OCPD. OCPD is obsessive compulsive personality disorder, not to be confused with OCD. Here's an exam tip for you. Know the theme of each cluster. And if you are a visual person, here's a visual for you. Take a screenshot, write it down, rewrite it, color code it. Remember these clusters. That's going to be super paramount in helping you pass your exam. Super paramount. I like that. uh, Borderline personality disorder, or BPD. We're going to go over a little of what is it entails. So here, if you look, I have 5 things listed, 5 different things listed, because I'm looking at the 5 of 9 criteria. Now, this is a rule that can be applied to a lot of what we see in the DSM. Many of the different diagnoses we see in the DSM require the 5 of 9. You have to have 5 of the 9 issues listed in order to be diagnosed in some cases. Now, there's more to diagnosing than the 5 of 9, but this is a quick and simple rule to help you. Also, too, depending on the what you're trying to diagnose someone with, there may be you have to have 3 of 9 or 3 of 5. But for borderline personality disorder and for many of the other disorders, you must meet the 5 of 9 criteria along with other things. So that being said, for someone to be diagnosed with borderline personality disorder, there'll be these kind of red flags that will help you. I'll call them red flags just based on being able to recognize it in a test question. Emotional instability and fear of abandonment. So I'll put it in Dr. Pam terms. Dr. Pam always says a borderline person will love you, love you, love you, or they'll hate you, hate you, hate you. They are on this emotional roller coaster all the time. They have emotional instability and fear of abandonment. They don't want to be left, so more than likely they will leave before you leave them, because that is a fear of theirs. Again, they have emotional instability. They're on an emotional roller coaster. If you do something they do not like and they loved you in the beginning, they will begin to hate you and they'll tell everyone how terrible you are. So they have emotional instability. Unstable self-image and relationships. Their relationships obviously suffer greatly based on their emotional instability. They give a lot in the beginning and will pull away when they have fear of abandonment, or they begin to have this negative self-image. Impulsive or self-destructive. So they partake in a lot of risky behavior. They are very like flight. They're just reactive, very reactive. Chronic feelings of emptiness and intense anger and mood swings. So these are 5 of, there's, I'm sure, a list of 9 in the DSM that people with borderline personality likely have. So keep that in mind when you are answering the questions. They love you, love you, love you, hate you, hate you, hate you, and they must have 5 of the 9. So why BPD, or borderline personality, stands out? Core theme of borderline personality, again, is emotional dysregulation. Dysregulation. The relationships shift quick from love to hate. They love you, they will hate you. Just like that. Snap of a finger. Often trauma or attachment based. So not to go too far off topic, but all of our early theorists who talk about attachment, Ainsworth Bowlby, Margaret Mahler, all of those people, Lorenz, they talk about and Harry Harlow, just to throw a few names out there, talk about the importance of attachment in early childhood. This is no different. Margaret Mahler actually refers to if you want to, or if a child must reach object constancy in order to not develop something like borderline personality or antisocial personality disorder. So it's important for attachment, because if they don't have early attachment, then things like borderline personality develop. All right. That being said, let's look at a quick comparison of the difference between borderline and the other three. Now, I'm only saying the other three because I don't want to go too far off topic. I just want you to know the difference between those three. So, borderline personality disorder, it's always going to be rooted in emotional chaos. So, while most of our personality disorder has some type of emotional thing going on, borderline personality is going to be rooted in emotional chaos. Narcissistic personality disorder will usually be rooted in ego and admiration. Antisocial will typically be rooted in manipulation. And that's a whole other video in itself. And then histrionic, attention seeking behaviors. So, that being said, we're going to take a look at a practice question. How I do practice questions for all of my exams is I read the question, read the answer choices, and then I use the process of elimination because usually two answer choices are completely wrong, like they're two completely wrong answer choices, and then you have two left that are one kind of sounds like it could be the answer, and the other one is the actual answer. So if you need to take a moment to pause to follow that process, do so. However, we're going to go forward with going over the test question. So I'll read it. And this is an NCE question. A client presents with unstable relationships, intense anger, and impulsive self-harm when feeling abandoned. Which best represents this presentation? Is it A, histrionic personality disorder, B, borderline 2 disorder, C, let me go back to B, bipolar 2 disorder, C, borderline personality disorder, or D, avoidant personality disorder. Little tip, if you mispronounce something or if you don't know what the word means, I always recommend going back and reading what is actually listed there because it can change your answer. So make sure you do that. That being said, I can automatically remove bipolar. Why? Because bipolar wasn't on the list of personality disorders. And two, it doesn't say bipolar personality disorder. It just says bipolar disorder. So we can eliminate that. Now I'm left with three. I'm also going to eliminate histrionic because I know a histrionic person is all about me. So I think about Maya's song. It's all about me, 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 me. That's for histrionic. Keep that in mind. Now, I'm going to go back to the question and pull out important vocabulary. Stable, unstable relationships is important. Intense anger is important. And impulsive self-harm. I know they are risk takers. They take high risk behavior or do high risk behaviors. Unstable relationships and intense anger are rooted in lack of boundary setting and emotional chaos, right? When feeling abandoned, they have a huge or a severe fear of abandonment. So that being said, avoidant people do have some fear of abandonment, but their personality is more so rooted in I'm going to avoid situations where I'm involved with other people because I don't want to be abandoned. That's not what this is saying. This is saying, hey, I'm going to try a relationship. I'm going to be on my emotional roller coaster. I'm going to do some self-destructing behaviors, and then I'm going to feel abandoned about it. That's not what avoidant personality disorder purports. That is more along the lines of borderline personality disorder. So that being said, NCE is about what you know. So while this may feel like a diagnosing question, it's more about like what you know, recalling what you know about what someone with borderline personality would look like. So if you chose C, awesome job. Again, the NCE is about what you know. Now, let's go on to the NCMHCE practice case. Just a little, I guess, caveat about the NCMHCE. This is more of a scenario-based exam where you are gonna actually have to use clinical judgment. So some say it's a little more difficult than the NCE. However, if you know your stuff, you know your stuff, period. So take a moment to pause if you want to go over the question, but we're gonna go forward. Jasmine is 30, and she reports chaotic relationships, impulsive spending, and self-harm during stress. She fears her partner would leave. The next best step would be A, conduct a suicide risk assessment. B, explore partner's perspective. C, teach relaxation. Or D, begin couples therapy. Now, little food for thought. For the NCMHCE, the first thing you are going to want to do is watch a Dr. Pam video on how to take this exam. But the second part of it is you're going to want to do assessment. Assessment is always going to be the first thing. Dr. Pam always says we are paid to be nosy. So get in her business and figure out what's going on. So we know that she more than, well, we don't know, but based on this, we can deduce before we go to the question that there's probably some borderline things going on. However, diagnosing her off the bat is not the best thing to do on this exam. We want to, A, conduct suicide risk assessment. We want to assess first. That's always going to be first. So with the NCMHCE, assess is going to always be first. Now, there are other steps to follow for the NCMHCE, but again, I recommend watching Dr. Pam's video on how to answer these types of questions. So the rationale, again, assess first, and then the focus of this exam is information gathering and decision making. You can be dinged if you choose to maybe, let's teach some relaxation. You're going to get dinged for that because that's not the first thing a practitioner wants to do. We want to be nosy. We want to conduct a suicide risk assessment. All right. So the NCMHCE for a question about borderline is always going to be this idea of application of clinical practice. You want to apply what to do in this situation. And we're not just going to say this person is borderline and we're going to give her some relaxation treatment or some DBT. We're not going to do that. We're going to do a risk or an assessment first. All right. Now, for the LCSW practice scenario, I just want to give my disclaimer. I am not a social worker. I am an LPCA, Licensed Professional Counseling Associate. However, these concepts will be assessed on all three tests. So even though we don't hold the same licensure, we do the same work and we will be assessed on the same things. So this exam question can be helpful for you as well. So let's take a look. A 35-year-old client with borderline personality disorder reports increased self-harming urges after being rejected by a friend. The client calls multiple times between sessions. Which DBT intervention fits best? Is it A, encourage suppression, B, set phone boundaries, C, lengthen sessions, or D, use exposure therapy? So the question tells you that this client is 35 years old. They have borderline personality disorder. They have the increased self-harm urges. And after being rejected, they are reactive, right? They are in, and it says also they call multiple times in between sessions. So right there, they're trying to assess what's going on. You are already their clinician. They are in DBT, or you guys are using DBT interventions to help them. So we want to know what DBT intervention fits best. So it's completely different from the questions we've seen before. So are we going to encourage suppression, set phone boundaries, lengthen sessions, or use exposure therapy? So based on them asking about what DBT interventions we're going to do, let's use the process of elimination. So we're not going to use exposure therapy because that isn't necessarily part of DBT. I don't think we need to lengthen sessions. So are we going to encourage suppression or are we going to set boundaries, phone boundaries specifically? The answer is going to be B. We want to set boundaries because it says the person calls multiple times between sessions. So they don't have a boundary with you. And with DBT, one of the processes is the interpersonal relationships. We want to ensure that we're helping them to learn to set boundaries with not just you as their practitioner or therapist, but in their other relationships as well. So the explanation here, DBT emphasizes structure and boundaries. And this exam, this LCSW, focuses on intervention and planning ethics. So the LCSW, their questions, including those on borderline personality disorder, are going to focus on setting limits, maintaining ethics, and planning treatment. So now that we made it through 3 types of the questions that we'll see on each of those exams, treatment for borderline personality disorder. The treatment, go-to treatment, or the gold standard treatment is usually dialectic behavioral therapy by Marsha Linehan. That tidbit you may need for the NCE. You may need to know that Marsha Linehan is responsible for creating DBT. And again, it is the gold standard. It teaches mindfulness, distress tolerance, emotional regulation, and interpersonal effectiveness. Other approaches like CBT, schema therapy, and psychodynamic theory are also approaches that are used as interventions. However, if your exam talks about borderline personality disorder and DBT is one of the listed interventions, it's usually the right answer. So keep that in mind. So differential diagnosis, the important piece here is know the differences. For bipolar 2, your mood will last weeks and days because mood swings are embedded in borderline personality disorder. The difference is for bipolar 2, your mood swings will last days, weeks, as well as for bipolar 1. PTSD is usually trauma driven. Something happened that triggers your trauma. Your histrionics are usually attention seeking folks, and dependent are usually clingy but stable. So the tip here for borderline personality disorder, you want to remember their fast, deep, reactive emotions. So that's the difference from BPD and the others. The clinical takeaway of it all borderline cases are not personality disorder, but all of our borderline cases are personality disorders, but not all personality disorders are borderline. That was a mouthful. I got tripped up. So I'm going to reiterate what I meant to say in the beginning. All borderline cases are personality disorder, but not all personality disorders are borderline. Because we have narcissistic, we have our histrionics, we have our avoidant, we have all the other things that fall under that umbrella of borderline, of personality disorders. Focus on emotional regulation and relational instability for borderline, and then know the DSM-5 clusters and treatments. So for the exam integration piece of it, the NCE is going to focus on theory and criteria. The NCMHCE is going to focus on case analysis and risk. Remember, when all else, assess first. That's your first go-to for the NCMHCE. We are paid to be nosy. And then our LCSW, treatment planning and boundaries. Final message. These differences appear across all major exams. We want to understand them because if we understand them, our clinical reasoning and confidence grow stronger. To join our next prep course, whether it's the NCE or the SW or social work, visit our website at academiccoachingforworldchangers.com or email drpam2020@gmail.com. Thank you guys for watching, and I look forward to seeing you in any of our groups or courses we offer. Lead with peace, purpose, and confidence. I'll see you in the next video.